You are on Ozempic or Mounjaro, and you're wondering what blood test you actually need. Now here's the problem. You lose weight perfectly, but underneath, your body enters what I call the silent damage phase. You think the weight is dropping, so everything is fine, but it is not. Your scale looks great while your metabolism and organs drift in the wrong direction, and most people sadly miss this. It's like driving at full speed with no dashboard. No warning lights, no idea what's happening, until something fails and suddenly everything crashes. I am Dr. Almerie, consultant weight loss surgeon and obesity specialist. In this video, I will show you the labs you need to check while on GLP-1, so you stop guessing what's happening inside and stay one step ahead, because by the time symptoms appear, the damage is already there and sometimes not fully reversible. Let's explore that. Now here is what most people miss. GLP-1 does not just affect your weight. It changes how your body works, your pancreas, your liver, your kidneys, your metabolism, all of it. There is a cascade of changes happening inside that goes far beyond the scale. And this is where people get caught. Because there are no symptoms. Nothing tells you something is off until it is. And by then, the damage has already happened. Now this matters even more if your system has less reserve, if you're older, or if your weight is dropping fast, because the margin for error is smaller and things can go wrong faster without you realizing. So to make sense of all this, there are two places things could go wrong. First, silent changes in your core organs, how they function. Second, micronutrients like vitamins and minerals, the essential things your body needs to function properly. Now, the only way to monitor this and detect problems early is through your blood tests, like the sensors in your car telling you about your engine, your brakes, your tire pressure, and that's exactly what we are going to explore next. The first lab is HbA1c. This shows your average blood sugar over the last 3 months. Not a snapshot, but a pattern over time. And this matters because it tells us how your metabolism is responding, how well your pancreas is controlling your blood sugar, and if you have diabetes, how it is responding to treatment. So this is not just a number, it directly guides your treatment. But blood sugar is only part of the story. Next essential lab is the comprehensive metabolic profile. In the UK, this is called liver function test and urea and electrolytes. Multiple tests in one, looking at your liver, your kidneys, and your electrolytes, giving a strong signal of how your body is coping. The third test is your lipid profile, cholesterol, LDL, HDL, triglyceride. This test matters more than most people think because it reflects your cardiovascular risks, your risk of heart attacks, stroke, the kind of risk that builds quietly over time. Now, the good news is that these markers often improve with GLP-1, but not always. And if you don't, your risk rises silently. No symptoms, no warning, while the scale is going down. And that is the trap. You think everything is fine, but it is not. Now, these 3 tests are not random. They show what's really happening inside your core systems, your liver, your kidneys, your heart, the systems that determine how long you stay healthy. Not just how long you live, but how well you live. This is your internal dashboard, sensors telling you what's happening inside your engine. Because tires, brakes, lights can be replaced, but the engine is different. If that fails, you don't get a reset, and every delay costs you time, function, and healthy years. This is how you stay ahead of what you can't feel yet. Now next, we will talk about micronutrients, the elements that are essential for your body to function, but are so easy to miss. Let's look at these. So let's go through the micronutrients you need to check. Then I will show you who is at higher risk and needs to monitor them more closely and how. But first, you need to understand what each one does because this is where everything connects. Vitamin B12, nerve function and energy. Folate, cell repair and red blood cell production. Iron, oxygen delivery. Vitamin D with calcium and phosphate, bone strength and muscle function. Zinc, healing and immunity. Now you might be wondering, how often do I actually need to check? Keep it simple. Check your levels before you start. Then, during the dose escalation, around every 3 to 6 months, depending on your situation. If things are stable, then yearly checks may be enough. This gives you a practical framework to discuss with your doctor, who will be personalizing the lab's monitoring for you based on your individual situation. Obviously, not everyone is at the same level of risk. Some people need closer monitoring. Those losing weight rapidly, we are talking more than 10% of their weight in around 3 months. Those with pre-existing conditions or poor diet choices before even starting. Older patients, and anyone developing symptoms like fatigue, hair loss, dizziness, or numbness, because once these symptoms appear, you are not just monitoring, you are catching up. Now, one last thing to complete the picture. There are other micronutrients less common, but important in more severe cases. Magnesium, selenium, copper, ceroplasmin, vitamin A. These are not routinely tested. They are only checked in selected cases when clinically indicated. Now, if you take one message from today's video, it is this. GLP-1 is powerful, and that's exactly why you monitor it properly. Because this is not about being afraid, it's about being in control. When you understand what's happening inside your body, you stop reacting late and you start staying ahead. So you lose weight while protecting your strength and your long-term health. Now, in the next video, I will show you the core supplements I recommend as a foundation, alongside the diet on GLP-1, the ones you should use routinely, and the ones you add based on the lab tests, so you are not guessing or taking multiple supplements without direction. Instead, you're being precise and confident. You can watch that video up here. I am Dr. Almerie. If you made it this far, you are someone who values evidence-based advice over random online fixes. And that's exactly what we offer on this channel. If that's you, subscribe so you don't miss what comes next. Thanks for watching. I will see you in the next video.